I'm Dr. Blanche Grube. I'd like to talk to you today about energy in the body. Oh, I don't mean the kind of energy you have to get up in the morning and, go out and run a mile, although that's energy also. I'm talking about energy flow and energy patterns throughout the body. The Chinese have had a system of energy patterns that they've had for almost 6,000 years. In Eastern medicine, they know that there's something called the heart meridian that runs from the pinky all the way up around the body through the heart, and also happens to pass through the wisdom teeth. In fact, there are 24 major meridians in the body. These are energy flows. 24 minor meridians in the body. And every single one of them, either directly or indirectly, runs through a tooth. It gives you an idea of, how important teeth must be. Well, there are things on our planet, in our environment, that interfere with these energy flows. For instance, you see that I'm wearing gold earrings. Well, this point where the earring goes through is an acupuncture point. So that means that the meridian that passes through this point encounters some interference, and it has to make some kind of modification for it to continue. Same with our teeth. When you have a amalgam mercury filling, or a gold crown, or a porcelain jacket on one of your teeth, that's going to interfere with the meridian that runs through that. As an example, the lower first molars in our system of numbering teeth in the United States, we use the system that would say the lower left first molar is tooth number 19 and the lower right first molar is tooth number 30. Those are our lower first molars. In European countries, that would be tooth number 3-6 or tooth number 4-6. Anyway, those lower first molars are connected to the large intestine's meridian. So that means that energy from the large intestines travels up through that meridian and goes through those teeth. If you have a gold crown on those teeth, or a mercury amalgam filling, or a porcelain jacket, that's going to present some sort of resistance to the energy coming up from the large intestines. That's not good. You lose energy sometimes when that happens. Anytime you have a metal filling in a tooth, in actuality, what you have is a small capacitor or a small battery that carries electrical charge. As a matter of fact, in Physics 101, you're told that anytime you have two dissimilar metals inside of a saline solution, that's what saliva is. Anytime you have two dissimilar metals inside a saline solution, you have a battery, which means you're going to have electrons flowing from one element that has a higher electrical pattern to another element. That happens all of the time. Now, anytime there's an electrical flow in the body or outside of the body, there's always an electromagnetic field that runs perpendicular to that flow. So if I have an electron flowing from this point to this point, coming across this way, then I have an electromagnetic field perpendicular to it, kind of like a big donut around a line. People don't want to build houses underneath power lines because there's an electromagnetic field that comes off those power lines. And it's been shown that the rates of leukemia are much higher for people who live directly under those power lines. Well, the same is true in your mouth. If you have dissimilar metals going from one side of the mouth to the other side of the mouth, you're going to have an electric current traveling from one side to the other. That electrical current, well, while it may seem small compared to the 120 volts you have traveling through the walls of your house, it may seem small compared to that. It's not at all small compared to the electrical current that goes on in your brain. As a matter of fact, it's 1,000 times larger than the electrical current going through your brain. So if I had myself a thought, and I had myself a thought that said, I'm going to get that glass of water, I just passed 70 to 80 nanovolts of electricity across my brain while I had that thought. When you have electricity traveling from one part of your mouth to the other, we measure that in millivolts. It's 1,000 times greater than the nanovolts traveling in the brain. So what does that all mean? Well, what it means is that if you have metal fillings in your mouth or metal crowns, you're not really thinking the way you ought to. You're really not having your brain function as freely as it should. So I'm not a lover of having metal in somebody's mouth. I really don't think it's a good idea. Is it possible, though, to have dentistry without metal? Without any metal whatsoever? Not really. Even the composite white fillings that people are having placed today instead of amalgams, even those have a little bit of iron oxide. If they didn't have iron oxide, they'd be as white as Snow White. And nobody really wants Snow White because that doesn't match the natural color of your teeth. So even the composites we put in people's mouths have a little bit of iron oxide, so they're going to carry a little bit of an electrical charge. Again, the best revenge is to never need to have a filling to begin with. But that's another whole lecture. We already had our lecture on cavities and how to prevent from having cavities in the mouth. But if you do have a cavity, you want to have a material put in your mouth that's going to carry less charge than a metal crown or a mercury, silver, tin, copper, zinc filling, which is already, I just mentioned 6 different metals in one tooth. You want to have a filling placed in your mouth that at least is going to have some insulation around the electricity. And that today is your composite fillings and your plastic dentures. At least the plastic does a little bit absorbing of the electricity in your mouth. So, let's get back to the meridians. If the large intestine meridian runs through the first molar, then you have energy that flows from the large intestines to the first molar, and then you have energy that flows back from the first molar back to the large intestines. And it's supposed to be a complete circuit. That complete circuit is supposed to be equal on both sides. Well, what if you have a tooth that is badly infected? What if you have a tooth that's root canaled? That doesn't have any life in it. A tooth that's root canaled is a dead tooth. It has necrotic tissue inside of it. Well, you're still going to have energy coming from the large intestines. It's going to go up to that first molar. Is the first molar going to give energy back to the large intestines? No, it's not going to do that. You'll have a constant flow of energy from the large intestines to the tooth. The tooth is not going to give energy back to the large intestines. So with time, the large intestines gets weaker and weaker. The only way to restore that energy is, if it's a root canal tooth, is to have the root canal tooth extracted. And when I say extracted, I mean extracted properly. That's complete with IV vitamin C, to have the socket rotor-rooted, to have the socket completely cleaned out, to be able to form a good, solid blood clot in that socket, which also, by the way, means not traveling far distances after the extraction. In our office, the patients stay in Scranton. They stay in a hotel that's a few miles away from our office. If you don't do that and you do lots of traveling, there's a good chance that that socket may not heal properly. But once the socket does heal, once you get a good blood clot, and that blood clot adheres itself to the bone, and that blood clot then turns into normal, healthy bone with good blood flow through it, then the energy is restored. And now when the energy comes from the large intestines up to that molar, it also gives back energy to the large intestines. So it's a complete circle, and both sides can affect each other. When a person has a dead tooth, like a root canal tooth or a tooth with an infection, energy still comes up from the intestines to that tooth, but the energy does not go back to the large intestines. So then the large intestines becomes weak because it's not receiving the energy that it needs from that tooth area. That can lead to all kinds of problems. People have problems like constipation, which is not really such a simple problem. Constipation can lead to impaction. Impaction can lead to colon cancer. Impaction can lead to things like diverticulitis. So there are all kinds of problems that people have in their intestines, and very often it stems from a lack of energy going to that area from teeth that are not healthy, not alive, not vital, and not giving back a fair amount of energy. So it's very important. So we have two things to think about. You want to have your teeth alive so that they're giving back energy. You also want to take into consideration the kind of metal that you're putting in a patient's mouth, the kind of metal you're putting in your mouth, so that you know whether or not there's way too much electricity. So how would you know that? Well, you could go to a biological dentist and have a test done. It's called an electrogalvanic test. We actually put probes on your teeth, and we actually have a meter that tells us exactly how much electricity is flowing through the teeth. I've had patients who have had as much as 980 millivolts of electricity flowing through one tooth. That's almost a whole volt of electricity. That's enough electricity to light a little flashlight. Okay, a little flashlight, it's little. That's not a lot of electricity, some people might say. Again, compared to the brain and how much electricity is flowing through the brain, it's a lot of electricity. You don't want to have that much electricity flowing through this section of your mouth. That kind of electricity can actually affect the way you think. It can affect your moods. Some people have actually been told, your problems are all in your head. They're actually right, except it's this section of the head, not this section.